Welcome to Lux Scout Psychology. In the hushed corners of our lives, a silent epidemic rages on, leaving a trail of broken lives and shattered families. Millions grapple with addiction. It's a complex medical condition. We must move beyond stigma. Behind every statistic, there's a human story. These are the human faces of addiction. The impact extends far beyond the individual. By acknowledging this, we create space for open conversations and effective interventions. To truly understand substance-related and addictive disorders, we must look beyond the surface. We must delve into the root causes that drive individuals to seek solace in substances or behaviors. Increasingly, experts are recognizing that addiction is often a symptom of a deeper struggle, a crisis of disconnection. Human beings are wired for connection. We thrive on relationships, belonging, and a sense of purpose. Yet, in our fast-paced, often isolating modern world, these fundamental needs are often unmet. The result is a profound sense of emptiness, a void that many attempt to fill with substances or addictive behaviors. They offer temporary relief, a fleeting sense of connection or control in a world that feels increasingly chaotic and overwhelming. For some, trauma lies at the heart of their addiction. Past experiences of abuse, neglect, or other forms of adversity can leave deep emotional scars. These wounds often manifest as anxiety, depression, or post-traumatic stress disorder. In an attempt to numb the pain or escape the grip of these overwhelming emotions, individuals may turn to substances or addictive behaviors as a coping mechanism. The illusion of comfort is often short-lived. While substances or behaviors may provide temporary relief, they ultimately exacerbate the underlying pain. Addiction becomes a vicious cycle, trapping individuals in a web of dependence and despair. Breaking free requires addressing not only the addictive behavior itself, but also the root causes that fuel it. Substance-related and addictive disorders are complex, multifaceted conditions with a wide range of contributing factors. It's crucial to approach these disorders with nuance, recognizing that there's no single cause and no one-size-fits-all solution. Genetic predisposition plays a role, making some individuals more vulnerable to addiction than others. Certain genes can influence how the brain responds to substances, affecting an individual's susceptibility to cravings and dependence. Environmental factors, such as early exposure to substance use, can also increase the likelihood of developing an addiction. Social determinants of health, such as poverty, discrimination, and lack of access to education and healthcare, can create environments where addiction thrives. These systemic factors contribute to a cycle of disadvantage, making it more challenging for individuals to break free from the grip of addiction. Research labs studying the interaction of genetic, environmental, and social factors in addiction. Understanding of the interplay of these various factors is essential for developing effective prevention and treatment strategies. Throughout this journey, we will explore the different types of substance-related and addictive disorders. We will delve into the specific symptoms, diagnostic criteria, and available treatment options for each. Our goal is to equip you with the knowledge and understanding to approach these challenges with compassion, hope, and a commitment to supporting those who need it most. Alcohol, a seemingly ubiquitous part of many cultures, holds a dark side that can ensnare individuals in a web of dependence. Alcohol use disorder, often referred to as alcoholism, is a chronic relapsing disease characterized by an inability to control alcohol consumption despite its negative consequences. It's a condition that affects millions worldwide, impacting not only their physical health, but also their relationships, careers, and overall well-being. For individuals struggling with alcohol use disorder, the desire to drink can become all-consuming. They may find themselves preoccupied with obtaining alcohol, planning their day around drinking, or spending an excessive amount of time recovering from its effects. The grip of alcohol can be so strong that it overrides their ability to fulfill responsibilities at work, home, or in social settings. The consequences of alcohol use disorder can be devastating. Prolonged and excessive alcohol consumption can lead to a range of physical health problems, including liver damage, cardiovascular disease, pancreatitis, and an increased risk of certain types of cancer. The impact on mental health can be equally profound, with alcohol misuse contributing to depression, anxiety, and an increased risk of suicide. The journey towards recovery from alcohol use disorder is often challenging, marked by setbacks and periods of relapse. However, with the right support and treatment, individuals can break free from the grip of alcohol and reclaim their lives. It's crucial to remember that alcoholism is not a moral failing, but a treatable medical condition. Seeking help is a sign of strength, a testament to an individual's desire to live a healthier, more fulfilling life. Cannabis, often referred to as marijuana, is a substance that has been shrouded in both controversy and misconception. While it's true that cannabis has been used for medicinal and recreational purposes for centuries, it's essential to recognize that its use can lead to dependence and a range of negative consequences, particularly for those who develop cannabis use disorder. Cannabis use disorder is characterized by a pattern of cannabis use that leads to significant impairment or distress. Individuals with this disorder may find themselves using cannabis more frequently or in larger amounts than intended, despite experiencing negative consequences in their lives. They may experience cravings for cannabis, feel unable to control their use, and continue using despite its impact on their relationships, work, or health. While the perception of cannabis as a relatively harmless substance persists, the reality is that its use can have detrimental effects. Chronic cannabis use has been linked to cognitive impairments, particularly in areas such as memory, attention, and executive function. It can also exacerbate existing mental health conditions, such as anxiety and depression, and may increase the risk of developing psychosis in vulnerable individuals. The legalization of cannabis in some regions has sparked important conversations about its use and potential risks. It's crucial to approach these conversations with a balanced perspective, acknowledging both the potential benefits and the very real risks associated with cannabis use. For individuals struggling with cannabis use disorder, seeking professional help is essential for navigating the path to recovery and reclaiming control over their lives. Stimulants like cocaine and methamphetamine increase activity in the central nervous system. These drugs can produce euphoria, energy, and alertness, but come with significant risks. Stimulant use disorder can have devastating consequences on physical and mental health. Stimulants induce feelings of confidence and invincibility, offering a temporary escape. As the effects wear off, individuals experience fatigue, depression, and intense cravings. Misuse can lead to cardiovascular problems, seizures, and respiratory issues. Chronic use can cause paranoia, anxiety, and hallucinations. Addiction often leads to neglecting responsibilities and relationships. In a world driven by instant gratification, behavioral addictions are a significant concern. Unlike substance disorders, these addictions don't involve chemicals. They center around behaviors that activate the brain's reward system. Gambling disorder is particularly insidious and misunderstood. Gambling has been part of human society for centuries. The allure of risking something for a greater reward is timeless. For some, the line between recreational gambling and addiction blurs. The seduction of chance lies at the heart of gambling disorder. The thrill of a near miss and the rush of adrenaline create a potent cocktail. Gambling triggers dopamine release, reinforcing the behavior. This initial excitement is often short-lived. As addiction takes hold, individuals chase losses, increasing bets. This cycle can devastate finances, relationships, and well-being. Gambling disorder is a mental health condition characterized by persistent and problematic gambling behavior that leads to significant impairment or distress. It affects individuals from all walks of life, regardless of age, gender, or socioeconomic status. The inability to control or stop gambling despite negative consequences is a hallmark of this disorder. They may gamble to escape stress, anxiety, or depression, leading to financial and relational problems. While casinos and other traditional gambling venues often come to mind when we think of gambling disorder, it's essential to recognize that this condition can manifest in various ways, extending far beyond the walls of these establishments. The rise of online gambling in particular has significantly expanded the accessibility and convenience of gambling, making it easier than ever for individuals to engage in risky behavior from the comfort of their own homes. Online gambling platforms offer a wide array of games and betting options, often available 24/7, providing individuals with constant access to gambling opportunities. The anonymity of the online environment can be particularly appealing to those struggling with gambling disorder, as it allows them to hide their behavior from loved ones and avoid the stigma often associated with seeking help. The ease with which individuals can deposit and withdraw money online, often using credit cards or other forms of digital payment, can further exacerbate the problem. The absence of physical cash and the ability to gamble with large sums of money with just a few clicks can create a disconnect between the virtual world of online gambling and the real-world consequences of these actions. Recognizing the signs of gambling disorder, both in oneself and in others, is crucial for early intervention and effective treatment. If you or someone you know is struggling with gambling-related problems, it's essential to seek professional help. The journey of recovery from substance-related and addictive disorders is rarely linear. It's often marked by twists, turns, and unexpected detours. With the right guidance, treatment, and support, individuals can navigate the challenges of recovery and reclaim their lives from the grip of addiction. The first step towards recovery often involves acknowledging the problem and seeking help. Therapy forms a cornerstone of treatment for substance-related and addictive disorders. Various therapeutic approaches have proven effective in addressing addiction. Cognitive behavioral therapy, or CBT, focuses on identifying and changing negative thought patterns and behaviors. CBT empowers individuals to challenge irrational thoughts and replace them with more realistic thinking patterns. Medications play a crucial role in the treatment of substance-related and addictive disorders. Medication-assisted treatment, or MAT, combines medications with behavioral therapy and counseling. Medications like methadone, buprenorphine, and naltrexone help manage cravings and withdrawal symptoms. Medications can also play a valuable role in treating alcohol use disorder. Building a strong support system is instrumental in supporting long-term sobriety. 12-step programs, such as Alcoholics Anonymous, offer a structured, peer-led approach to recovery. 12-step meetings provide a safe and supportive space for individuals to share their experiences. Smart Recovery offers a science-based approach to addiction recovery. The journey of recovery is often long and winding, marked by both triumphs and setbacks. While the challenges of addiction can feel insurmountable, recovery is possible. The prognosis for individuals with substance-related and addictive disorders varies widely. It's crucial to approach the concept of prognosis with sensitivity, recognizing that each individual's journey is unique. Early intervention can be the key to altering the trajectory of an individual's life. Early intervention can prevent the escalation of substance use or addictive behaviors. By fostering open and honest conversations about substance use, we create an environment where individuals feel more comfortable seeking help. Recognizing the early warning signs of addiction is paramount for prompt intervention. Addressing substance-related and addictive disorders requires a holistic approach. This approach acknowledges that addiction doesn't occur in a vacuum. Behavioral therapies provide individuals with the tools to manage cravings and cope with triggers. Support groups, such as Alcoholics Anonymous, provide a sense of community and accountability. Substance-related and addictive disorders present a formidable challenge. Yet amidst the complexity, there's an enduring message of hope and healing. While the path to recovery may be long and winding, Each step taken towards healing is a victory worth celebrating. Addiction is not a moral failing, but a complex medical condition that demands compassion, understanding, and effective treatment. As we move towards a brighter tomorrow, our collective responsibility lies in fostering a society that prioritizes prevention, early intervention, and access to evidence-based treatment for all who need it. We must challenge the stigma that often surrounds addiction, replacing judgment with empathy, and creating spaces where individuals feel safe seeking help without fear of shame or discrimination. By investing in research, expanding access to affordable health care, and supporting community-based programs, we can make a tangible difference in the lives of those affected by addiction. It's time to shift our focus from punishment to healing, recognizing that addiction is a health issue, not a criminal justice issue. Let us remember that behind every statistic, there's a human story, a story of struggle, resilience, and the enduring hope for a better life. By cultivating compassion, understanding, and a commitment to supporting those on the path to recovery, we can create a world where addiction no longer holds individuals captive, but empowers them to reclaim their lives and embrace a future filled with possibility. Together, we can break the cycle of addiction and create a brighter tomorrow for all. Let's choose hope, choose healing, and choose to walk alongside those navigating the path to recovery, offering our unwavering support every step of the way. Please like the video and share it with others. It helps those who are suffering. Thank you for watching.